Cardiovascular disease, because it affects a third of the world's population, is the biggest epidemic mankind has known, and it affects societies as a whole. The World Heart Federation, in response to the WHO and the UN General Assembly, declared to reduce cardiovascular disease globally by 25% by the year 2025.
There's a serious need for innovative thinking, for changing the paradigm around cardiovascular disease, recognizing that what has worked in the past probably will not work in the future, and we need to take a very different approach.
We need people with a new set of skills who've shown that they're motivated and bright, and these are the people we call emerging leaders.
The emerging leaders are 25 individuals coming from 16 countries with a diverse range of backgrounds. We want people who are creative, disruptive, not looking for sort of small ideas. By putting them in a position where they can get unique training from world-class faculty with just some of the best people around from which to learn.
All of us here are interested in the same cause, which is hopefully reducing cardiovascular disease at a global level.
We have cardiologists, we have nutritionists, epidemiologists, we have people talking about essential medicines. It's a great platform.
It doesn't matter whether you're from Canada or from Burkina Faso, there's still a big gap in application of the knowledge that we have.
It's amazing to discover that you actually are not that far away sometimes from other countries in terms of challenges, and how we can actually move with this network of dedicated people from all over the world in order to improve care worldwide.
We listen to stimulating and sometimes controversial talks, and we also engage in small group discussions on a specific proposal that we can put together by the end of the week.
At the end of each 5-day think tank, they will come up with 2 or 3 collaborative projects.
You're working on a research protocol throughout the whole period so that at the end there's a written document that can be taken to different research funders. Again, leveraging the time that people are spending here.
So we are not only going back with great ideas and great thoughts and protocols. 3 wonderful groups has been bonded. We are actually thinking about a team approach, and the World Heart Federation is going to provide us with little seed money so that we can get along with our project. That also makes this whole platform a little more different from all the other platforms that we have. It's providing you with a little seed money to go after your dreams.
The emerging leaders are at a key point in their careers where they're frequently just about to take off, and this is the sort of experience that we hope really lends itself to them devoting their energies towards improving the health of the world. And by trying to achieve 25 by 25, that's a pretty big goal, but I think these are the right people to do it.
The Emerging Leaders Program is probably one of the most cost-effective ways to achieve the 25 by 25 goal. And that's because by definition it mobilizes resources. If you identify the right key champions in a country, they can help be the key agents of change for helping to address and reduce the burden of cardiovascular disease.
From the knowledge I've gained, I want to take this back to my country, especially what we call the Nigerian Cardiac Society, to use text messages actually to the general populace on how to actually reduce the risk factors of cardiovascular disease, especially high blood pressure and diabetes, which is a big problem in Nigeria.
We need to be bold, we need to be innovative, we need to be naive, optimistic. It's the right time to be ambitious and think big.
I think it's so important to keep going because we know that we won't see any results for the next few years. So we'll have to keep working to see these results. That's why it's called the 25 by 25.
And I'm really glad that the World Heart Federation has taken this on, because we are poised collectively to make a big impact in reducing heart disease and strokes worldwide. And with this cadre of young people, I'm sure we will transform the world.